Good morning, and thank you very much for joining us. I am Yori Fulani. Let's go back to health. We haven't talked health in a long time. I don't know, have we forgotten about COVID altogether, COVID-19? Well, it does look it. It does look it when you just walk around town, places that, used to be quite meticulous about those precautions, those safety precautions, mask up, wash your hands before entering, in some cases, safe distance. All of that seems to be in the it just has this feeling of being almost in the distant past. This is in the public health area. So we'll be talking this morning with Dr. Nneka Onwu. Dr. Nneka Onwu is Director of Primary Healthcare System Delivery Development, and she's with the National Primary Healthcare Development Agency. So as soon as we can get her online, we'll be talking with her to find out what exactly the state is of our healthcare. Oh, there you are. Good morning to you, Dr. Onwu.
Good morning.
Good morning. Thank you very much for making time for us. Now, as I was just saying, I did my own little rant about the state of anti-COVID measures. We seem to have relaxed a bit, but maybe I should just step that down. It's possible that you might cover it when you answer my first question, which is, could you sort of give us a situation report? What's the state of public healthcare delivery in Nigeria?
Okay, thank you very much. And I think this is a very important time for us to be talking about the state of public health in Nigeria. On the 24th and 25th of March, the Honorable Minister of Health will be hosting having an international summit where we'll be talking about health and the state of the public health in Nigeria. It's going to be a health summit on the 24th and 25th. And what we'll be talking about is a 4-point agenda, the strategy of transforming our primary health care system, which is really the base, the foundation of our health system. We all know with COVID, it exposed a lot of weaknesses, not only in Nigeria, but all over the world. But we are hardest hit in terms of that because we had issues with our public health system, especially the primary health care system. So this 4-point agenda, which we'll be talking about, will be aligning and harmonizing across, all the stakeholders. This time, we're having our private sector very much involved, our partners and government, not only at the national, but also the state and community levels. Everybody's going to be involved, talking about the situation that you mentioned. What do we do about primary health care, which is the foundation of our health system? When you miss it, if you miss a foundation, if you're building a house and you don't have a foundation, you can imagine the type of house you have. So that is why we'll be talking about that at that summit on the 24th and 25th. And that will be when we're discussing the 4-point agenda. So access and service delivery. What is it about? Human resources for health. Mm-hmm. We know, and I'm sure if I ask you, you don't know where your primary health care is in your village, but we'll talk about that when you ask me again. Please go ahead. Thank you.
Indeed, these are indeed interesting things too, because you are a consultant, public health physician, doctor, and you actually head up a team that sort of assists states and local government areas in their efforts at healthcare delivery. So I wanted to ask in that connection, what exactly has NPHCDA, what has it been doing? What has it done to further this cause?
We've done a lot in terms of furthering this cause, in terms of supporting the states and the LG and community levels in terms of what we do at that level. We're talking about PHC revitalization. How do we improve access and service delivery? So we've identified what we call a minimum health care package for each political ward, and that defines the level of human resource you will expect there. So who are the midwives, who are the nurses, what is required. Also, we are looking at other structures structures, the infrastructure, the commodities, and how this links up with the community. What is at the community level, what is at the ward level. These structures are very important to us, so we are looking at how to expand, and we'll be doing a lot around that human resource for health in supporting the states to identify what is required and also building capacity. But we are going forward as part of the revitalization to ensure that we also mentor them, because we want quality service. You will find that most of our people, they will skip the primary healthcare level and go to secondary and tertiary, and it exposes them to a lot of burdens, especially financial burden. They spend a lot. Out of pocket expenditure now is about 76%, and our universal health coverage expects it should be about 30%, and so it's really a far cry of what is expected. And this is where we are aiming at, that this summit is going to be exposing and discussing what we need to do together to see that this happens no more. What of our insurance scheme? We're at 5%. We expect to be at 90%. So all these are things that we are talking about. But primary health care has been doing that and shining the light and doing and supporting the states. Of course, this government, when it came in, they were talking about PSC revitalization. And revitalization is not just painting. Some people think that revitalization is go and paint it and put new windows. No, it's not that. So our PSC revitalization is talking about having that right infrastructure, the right human resource, expected number that will be there to ensure that we have 24-hour service, that a woman can walk in and have a safe delivery because they have the right human resource there. And of course, the commodities are there as well, and that there is light. So we're looking at a model where we have solar, solar light, because most of our communities are not connected to NEPA. So there's a joke about somebody went to deliver and the baby came out dark. They say, oh, you must have delivered in a primary care center because they don't have light. So we don't want that anymore. And that is one of the models we have, that all our PACs will be connected to the grid and have solar power. And that, in essence, make sure that we have the human resource, the midwife, who is also trained and mentored to be able to provide that care, respectful maternal care. We have women who are delivering and they get slapped and knocked around, for one reason or the other. Why should we do that? And that is what we are talking about, revitalization. Revitalization is also talking about the infrastructure, the security, the environment, the conducive one. That when you walk in, you like your wife to be there, you like your child, you even will walk in there to, receive service before you now start talking about the secondary and tertiary where you're referred to.
Okay.
And in referring you, revitalization is that we have, a referral, an ambulance or a service that will make sure that you get to the next level and you're also treated with this, adequate respect. And in addition, also what we are doing is what we call the CHIPS, which is promotion, demand stimulation. We have those people at the communities. These are people identified by their communities, respected people, and they know each person, they know each household. So we link them up, the PAC and the community. These are people, women or men, as based on the culture of that place, to ensure that everybody is linked to service while providing health education, health promotion around everything, including anything to do with child health, maternal health, even environmental health. And then we link them up also to call the ward development committees. We have these ward development committees. MPACD has done that. We've sensitized them. These are the accountability mechanisms within the community. Each ward will have a development committee that's linked to a village development committee, and what they do is to ensure that they provide accountability and also link that community to the PHC so that you have a seamless interaction across these levels. That's what MPHC has been doing. In terms of program delivery, we've had about successes with polio. We've been able to achieve that elimination of polio, and with our COVID we've done quite a lot in that drive. So these are the programs we have, platforms we have, which is linked to the states and the LGAs. These are the National Emergency Routine Immunization Center and the National Emergency Maternal Child Intervention Center. These are centers that are focused on these aspects to ensure that we derive, that same improvement that we derived in terms of polio. What did we learn from polio? We are linking this to these particular platforms, linking to the state to ensure that we address issues, so that issue about maternal deaths will be something of the past. Of course, you can't do these things without an enabler, health financing programs and all that, data visibility. These are issues. These are the things that are in the 4-point agenda that we'll be discussing at the summit. How do we work together as stakeholders? When a partner comes, our tier system allows the person to go right down to the state. But we say, no, let's put it all together here, find out what the problems are, and work together to deliver that. And the private sector, they are saying, yes, we want to come along with you. And what we are going to do now to ensure that at least in one LGA, we have that right service one, PAC that delivers all this minimum package of care. And of course, we know that there's what you call the PPP, and the framework for this is from the MPACDA. So these are things that we are looking at for this summit, and making sure that we revitalize and make our people come back to the foundation, so that we have better health for our people.
Indeed, and that is, as you indicated earlier, the primary healthcare delivery system. Now, I wonder, Doctor, if, because there are a lot of Nigerians think of, I would just guess here, but I'm thinking that, look, they would want to go for the simplest of ailments to a teaching hospital, believing that, oh, that's where they will get value for their effort, if not money. Value for their effort of going to an hospital at all. In other words, is there a sense in which sometimes people, maybe through ignorance, tend to look down on how very much primary healthcare deliveries, healthcare services can do for them? They just want to go, if not to, a university teaching hospital. I mean, just to give birth, for example, there are people who will do as much as they can to do so in a, university teaching hospital, believing that that's where they have expertise should anything go wrong. What can you tell us, Doctor, sort of redirecting those kind of people and allaying their fears? Surely there are equally qualified in a different way doctors, medical personnel in the primary healthcare delivery systems too.
Yes, we have. One would say over the years, we don't have enough. And that is what the summit is talking about, and how we are pulling together to ensure that we have enough of these people at the primary care center, where they get, the health for their money, going all the way to the teaching hospital, which is a referral site, really. It's for those illnesses that are, beyond, and you need referrals, you need specialist care. But if at the primary care level, you have the right, the doctor who has been trained as a public health physician, or where you don't have the doctors, of course, we have the nurses, the midwives who have been trained to deal, and they have all that. So if you get the quality of care, you walk in, there's light, the environment is good, of course, somebody will want to stay there. Why go all the way to a teaching hospital where you queue up for a whole hour, a whole day trying to see a doctor, when whatever it is, malaria or deliveries or whatever, cough, catarrh, anything that can be, all our minimum package of care is already accommodated, and it can be done. We can screen you for those diseases and even refer you, and if we refer you, we know we are linking you to another secondary site that is within the cluster that provides oversight, or one can refer to for that PHC. So it's less stress. You don't have to go to a teaching hospital and spend hours when you can get the same service. They say, why look for what in Sokoto, where you can see it in Sokoto or something like that. So what you can get at the PHC, why go all the way to a tertiary facility that's so far away? Okay. Where you have one just 5 kilometers from you, where you have routine immunization, you have the midwife who will care for you and see a safe delivery, and she gives you that respect, and you have the commodities, you have light. Why would you want to just go to stress and go all that way? That is what we are saying. Our PACs, yes, we have the vulnerable persons, 70% of our population are in these areas. They are in our communities. They can't even get to the teaching hospital. Can you imagine how much it will cost them to get there? I was in one community somewhere in Kaduna, and what it cost them, 500 naira to get from wherever to the secondary facility just to get that care. And they didn't have the 500. So what does the person do? The person stays at home, and you know what it means. So yes, we're saying our structure does not say we should go to the tertiary. Our structure says go to the primary, the first level. From the first level, then if there's an issue, go to the second, and where they cannot deal with it, go to the third. So as you do it now, you find that fewer people are in tertiary, and they cannot deal with those complicated cases. Where other cases are not complicated, we can deal with it at the primary care level. That is, I agree with you that is what we should be talking about, and our people should know that the primary care centers are there. And I urge you, when next you're in your village, to find out where the primary health care center is, so that you can also see where it is, because most people don't know where it is. So
indeed.
Wherever you are,
I will make a point of finding out, Doctor. Now, you spoke earlier, part of this whole health equation, if you like, is something you touched on, that healthcare insurance, we would like, you know, if wishes were horses and beggars could ride, we would like 90%. But did you say it's somewhere around 5%? And surely this must be impacting, you know, your efforts. Maybe I should just say, what do you think we can do to make, you know, public healthcare delivery accessible, affordable, and qualitative as well?
So thank you very much. Here we're at 5% because really what we have now is looking at the formal sector and is about 5% or short of it. But we're looking at everyone. And I think that is why there's a bill we passed about mandatory health insurance to make sure that everyone is covered, even those in diaspora. So they'll be part of this discussion at the summit and discussing the ways and means of how to make sure that everybody is covered so that they don't suffer any, you know, any kind of stress when they want to get health service. I know that even when we talk about corruption, you know, these are ways of dealing with this thing, because if somebody is comfortable that they can get the health care they want at the primary care level without spending much and they have an insurance, you know, why would the person just, you know, continue? You understand what I mean? So I think that government is looking at, and they'll be part of the discussion we are having, the National Health Insurance Scheme. They'll be also at this summit, as well as talking about health security. The NCDC will also be at this discussion with the Executive Director of National Primary Health Care, and of course the Honorable Minister and the Vice President leading the discussion about transforming our primary health care. What we need to do together with the private sector, you and I and the communities, to see that we have the primary health care that we can afford and that, you know, we deserve.
Okay. Now, Dr. Onwu, let me just get your impressions on COVID. You've mentioned it in passing. We didn't dwell on COVID because there are other you know, public health issues as well. The world seems to have a different perspective on COVID now. Maybe the panic has died down. People don't seem as scared. In fact, perhaps from a medical point of view, it's possible to say people might be seen to be being reckless, but that would possibly depend on what the situation is. You know, doctor, that in the West, countries have totally relaxed. The UK, for instance, said that forget all the documentation, all the protocol, all the wahala about COVID-19, no more. Just go back to the way we were before. If you want to come into the UK, come on in, and so on and so forth. What do you think of our situation? Can we also relax, as the public seems to have done on its own initiative?
That's where we go and buy what the West is doing without looking at what we should be doing. The West have achieved more than 90% coverage in terms of first, second, and the booster doses. Of course, they've achieved herd immunity. They've protected their populations. We are far from that. We are far from that. We've not protected. It's like having one window with a burglary proof, and you say the armed robber will not come in. They have secured their people, the populations, that they can, you know, relax while, you know, paying attention to other things. And also they have, you know, strengthening their system. What they are doing now is strengthening their system to make sure they have, you know, a system that can also take in any of these emergencies looking forward. And that is what we are doing. So we are doing it two ways. We are looking at strengthening our health system. At the same time, also, we have to step up in terms of COVID vaccination. We are not out of the woods. We are just short of, you know, 15% coverage, and we are aiming at 70% by the end of this year. They've achieved it in the fastest possible time. First dose, second dose, you know, booster. We even have a J&J, which is a one shot that gives a cover. So we want people to get vaccinated and continue to do what we are supposed to do. Protect yourself, protect your loved ones. We are not out of the woods. The West may be out because that's the West, you know, but we are not in any way are we near that 70%. So my appeal, and I'm sure that appeal comes from my chief executive and that of the Honorable Minister and the Vice President, as they'll be talking about health security and our system, how to strengthen it, at the same time ensuring that people go and have their vaccination. First dose, second dose, booster. It gives you the right protection. No matter where you are, you will be protected.
Just quickly now, people are saying that the boosters, the booster shots, if we're not careful, would seem to go on forever. Is that exaggerating it a bit? Because they say after this, they say there's a need for another booster. How many boosters before one can say one is clear? Or is it something of a lifelong kind of a treatment?
people said a lot of things. People say if you take it, you fall and die, and then people are still here 2 years or a year after. No, we found, everything around this COVID, though is novel, but a lot of research is going on. And I think in Israel, they tried a fourth dose, and they found that it doesn't confer any additional, support or immunity compared to the first booster that you take. So no, as much as we know now, based on the science we know, first dose, second dose, and your booster, it depends on the vaccine. If it's J&J, you have the one dose which covers you, and then the booster is the second one. That is what is advised. That's what we have from an advisory based on science, based on what we have seen. And I'm sure that is what Nigeria will continue to do. But, I don't think people should worry. What's important is that you are protected from having COVID. You're protected from dying. Your loved ones are protected. Our children, they take a lot of vaccines as well. And we have boosters for them, So it depends on what gives that protection so that you don't die unnecessarily when we can prevent it, really.
Well, thank you very much, Dr. Nneka Onwu, Director of Primary Healthcare System Delivery Development. Thank you very much for, and I wish you, a successful celebration at the upcoming seminars.
Thank you, and I trust you'll be there. TVC is always there, so we're looking forward to seeing everyone at the summit. If not, you can also join virtually when we are on to see that you join the discussions around what we can do together to improve our system. Thank you very much.